Thank you all for those great overviews. And I'm going to direct my first question here to Jim and Dina. And I would just like to explore a little bit further with you. I know you've said that the foundation arm and this kind of operational arm are very integrated and linked. But could you just say how those decisions are made? So, for example, on the foundation arm, what the outcome, do you end up working in the same locations as the operations exist, with the same communities, or are they lessons learned that bring you together?
So I'm kind of compelled to say this because we're in Washington. That the ExxonMobil Foundation, for tax purposes, does not take direction from the corporation, right? So don't anybody be calling the IRS and said that I said we're so integrated and linked that we somehow follow. And we understand the IRS regulations on corporate foundations that stipulate that we can't make grants to further business objectives. Okay, let me just say that. So as I wasn't super clear on that the first time. So to this point, we have a board of trustees that approves a strategic approach to our foundation work. Generally, it's a 3 to 5 year plan. It hasn't changed much dramatically since the year 2000. We've kind of tinkered at the edges and looked at various emphases on what we should be funding and how we should be behaving, and what projects we should be funding in three big buckets that you talked about at the outset, Kathy. I think everybody knows that our founder, John D. Rockefeller, heavily invested in education, especially in the United States, among minority and underserved populations. That legacy continues today in the company. So that one piece we inherited from what had been one company, then was a whole bunch of companies, and now two of them came back together in terms of making the company we are today. The fight against malaria, I explained to you how that came about in the year 2000. In 2005, we kind of looked at strategically where we were investing money and what countries we were investing in, and realized that a lot of them are not malaria endemic. So because we're geniuses, we figured out that there actually are women in all those countries. So we started a really significant program on fostering women's economic empowerment in those places. So strategically, those are the three buckets that don't change. Now what changes, especially in the health piece, is the emphasis and what we fund. So in the fight against malaria, if we had this conversation a decade ago, we'd be talking a lot about bed net distribution and RDTs and making sure that the treatments that were available, that Jeff's company makes, were out there and available to individuals and communities that needed it. Today, we much more heavily focus on healthcare infrastructure and making sure that there's capacity building in various places where we operate, and in neighboring areas as well. We try to do that Gretzky approach of thinking what's coming down the pike instead of what we had been facing, and so we try and anticipate issues that are coming up in global health in general, but specifically in the fight against malaria. As a matter of fact, 2 days ago, Dina and Mark Dybel hosted a breakfast roundtable here in Washington on the current challenges in the fight against malaria and what we would be looking forward to in the next decade or so. I think that we have to be honest about this, and the money that we give away, although it's substantial, is still a small amount compared to major bilateral donors or even the Bill and Melinda Gates Foundation. So what we try and do is fill gaps and plug in where the major donors are not funding. So if, for example, the Gates Foundation is not funding a particular organization with advocacy work, then we'll step in and do that. We do donor coordination meetings. We try and avoid replication when it's possible. And again, I take to heart the comments that were made earlier about nobody ever turns down a second paycheck, but so we try and monitor that ourselves. One thing I think that's really important philosophically to remember about the work that we do not try and replace governments or agencies or international health authorities on what we're doing. We do not assume that responsibility. We don't have our own plans. We don't create malaria plans for various countries in West Africa. We try and look at the plans that are out there and try and figure out how best we can help meet the goals of those plans. And I guess the last thing I would say is that and maybe this gets to Ambassador Birx's point, that we work very much at the foundation level of going beyond check writing, right? So if all I had to do was write checks to grantees, I'd be done in a week, and I'd have 51 weeks to hang out, which doesn't sound so bad, but it's not what we do. I mean, I think, Brenda, you'll appreciate that, right? So I was just thinking on the last panel, when Allison was talking about her work at AB InBev, what we do and how we engage our employees in the work that we do from a grant making perspective. So I just jotted down some things that I've worked in the past 3 months on how to plug in the core competencies that make us profitable as a company and how we use those to advance these health objectives. And I came up with, we help our partners, and I can show you that list of our partners here. And these are the strategies that we're supporting right now. We help them with government relations, with advocacy, with communications, with media relations, with advertising. We help them with project management, how to get from A to B most efficiently. We help with fundraising. We help with chemical engineering in some cases, technical assistance in epidemiology, how to do better monitoring and evaluation. We help with procurement. We help with human resources. And we basically help with how to operate most efficiently in a resource-challenged environment. And I think one thing to remember, and then I'm sorry for hogging all the time, Dina, but one thing to remember about this as well is that even though we're an energy company, there are certain aspects of the way Dina's operation works that really make us valuable to the healthcare research sector as a whole. Clarion could tell you about the work that he did when he had Dina's job with the French Army and coming up with new chemoprophylaxis compliance tests. But I'll tell you one thing that I learned last year when we were working on a major project with Oxford University on anti-malarial drug resistance was that we have one of the largest repositories of blood samples in Africa. So for us, lending out that kind of asset is something that I think a lot of people find useful. Last thing I'll say, all of those things that we do from, in terms of helping our partners meet their goals, generally comes from us offering it. I think one thing that I've learned over the decade of being in this job is that, I've had this job for 10 years, is that, is that most NGOs and most governments do not come to us and ask us for this. They still, to this day, even though I think the public-private partnership model has matured in some aspects, still it's very much come to us for a check, and then we don't operate that way, so we share DNA. Oh, that sounded really bad. No, we get into that. I didn't mean that. We get into the DNA of organizations, and and vice versa, right? We look at each other culturally and how we work together most of the time.
I think that's a great example of the types of technical assistance that can be provided. Dina, did you want to comment on that? I have another question for you. If you're
Okay.
Go ahead.
Well, I was just going to, let me just piggyback on that. Our medicine and occupational health unit is not making grants. However, on a local basis, across all of those locations where we're operating our own clinics, we're building relationships with that community health system. Chances are, whatever challenges they're experiencing, we're probably experiencing some very similar challenges, and there's strength in collaboration. So when we think we have figured out how to resolve something, we will reach out to our partners, our health partners in that location, to partner with them and to show them how we've resolved it and see if it will work for them. Calibration of equipment is a big issue. It's a challenge, keeping your equipment up and running in many of these locations. I was laughing with Jim earlier today. We work for a company of engineers. They simply cannot tolerate equipment that is not calibrated, et cetera, to the T. But we will partner with them if we have found a resource that's actually going to come in country. Why not tell them, when I get my equipment equipment calibrated? Does anybody else need equipment that's calibrated, et cetera? In terms of, I can remember in Nigeria having some challenges with some of our malaria diagnostic methods. We ran our own lab there, and we wanted to make sure that we had it straight and that all of our technicians were trained. We had blind samples sent to us, so that we could, test them, random blind samples, and also training. But we turned around and we invited the community labs and clinicians surrounding us in the Lagos area to come and sit with us and share that resource, and even to the extent that they wanted to join that blind sample program to see how good they were getting, to join in with us on that project as well. So those are just some smaller, more local ways that we reach out and to the local community.
Well, Dina, you have supernatural powers, because that was going to be my next question. So I just want to read the question to you that I was going to ask her.
It's Jeopardy.
How does ExxonMobil partner with government or align engagement with public sector priorities? So I think that you've touched on that and how you're working in the local communities together. Ben, I wanted to ask you if you could expand a little bit on some specific examples. I wrote down as you were talking that it seems to me your model is you have this technology and you're developing all these amazing kind of entrepreneurial uses for your technology to improve health and education and agriculture, and then partnering with people to do that, and then segueing that into an actual business development piece. Could you give some examples of where that's kind of gone, different stages of that process that you've been in with some of your projects?
So I have to say that, the way Safaricom is structured is quite interesting, in the sense that we have the business arm of the organization, and we also have the foundation. The most interesting bit is that we sit together with the foundation team, my unit and the foundations. We sit within the same division. But the essence of all what we do is a matter of sort of like ensuring you work with other people to deliver the specific solutions you want to deliver. So if you look at, as I said earlier, our expertise is in a certain area. Our expertise is in the mobile phone technology, but other partners usually come with solutions which are unique and specific to either health, education, or agriculture. So what we do is basically we do have a partnership onboarding model, whereby through that partnership onboarding model we are able to evaluate the solutions which are being brought to the organization. And we look at these solutions in two, we have different ways of evaluating them. You can wear the business lens, or you can also wear the social good lens of it, in the sense that if it's a solution which eventually will translate to a product which can be sold through the normal selling route, you take it through a certain gate process. If it's a solution which doesn't have immediate sort of like revenue targets or anything, you incubate it for a certain duration. So what I've really realized is that our unit has become more of like an incubation ground for the bigger business, in the sense that we incubate initiatives, and once now we are able to say that indeed these initiatives make commercial sense, we move them to the business units. But the foundation also, just as ExxonMobil said, there is a clearly cut line that whatever comes from the foundation is not supposed to benefit the Safaricom as a business directly. But now in technologies, there is a thin line in between, because you realize that the foundation is funding initiatives which requires technology to some extent. So what the technology, or rather what the foundation has done in Safaricom, is to come up with what we call technology for development, technology for good. So technology for good initiatives allows them to sort of like procure or rather leverage on the mother company assets, which ordinarily, if it wasn't of that initiatives, the foundation or the rules governing how the foundations relate with the main company would have been violated. So I don't know how to put it, but our journey is usually based on the kind of engagement you are having at that particular moment. Some of the examples I can give is like the engagement with we had with USAID at one point. USAID came to us as Safaricom. And I usually mention this because it was one of my first assignments when I joined Safaricom. And they wanted to bring about efficiency and effectiveness in management of the TB program in Kenya. They were supporting the TB department within the Ministry of Health. So what Safaricom did is to bring along other organizations. You realize that there is a clinical component of it, and then there is the financial management component of it. And based on the skills of these startups, you are able to sort of like assemble them together and then develop a solution which has been very effective in management of tuberculosis in Kenya. People are able to capture all the vital information, and at the same time, you are able to send the incentives to the TB patients so that they can adhere to the DOT strategy, they call it direct observation strategy, whereby you have to walk into a facility, you take the medication. Once you take the medication, immediately the caregiver confirms that you've taken the medication, you get an incentive which allows you to go back to the facility the following day. So it's those sort of solutions which we develop with partners, which excites us and makes us unique in the sense that, by the end of it, they are coming closer to us as a business, but we are also seeing difference. The country is also able to achieve certain set goals and KPIs in terms of health service delivery.
Well, thank you. Well, we've kind of reached the end of our time for our fireside chat. I thank you all for staying awake. I just one final comment. I see, how I first tried to introduce this topic as this virtuous cycle, really, of the knowledge, the expertise, the resources, the tax base, the employment, that all of these activities bring to individual countries and should smooth the transition, if we're talking about however you want to define the transition in terms of health financing, infrastructure, but should also expedite the transition in favor of the countries. So join me in thanking our panelists.